Supportive kidney care. Choosing not to have dialysis. If you have advanced kidney disease and your kidney function is getting worse, your kidney team will explain the treatment options available to you. Your kidney team will help you understand if a kidney transplant, dialysis, or supportive care is suitable for you. Everyone's situation is different. Kidney treatments that are good for some people may be less helpful to others. For some people, kidney disease is their main health problem, and they are otherwise well. Other people may also have heart problems, memory problems, or may be living with frailty and finding it harder to manage everyday tasks without help. These differences are important when deciding which treatment options are right for you. A kidney transplant is an operation to place a healthy kidney from another person into your body so it can take over the work your own kidneys can no longer do. Some people may not be fit or strong enough to have a kidney transplant. Your kidney team can give you more information about kidney transplants. Dialysis is a treatment that cleans the blood and gets rid of extra fluid from the body when the kidneys can no longer do it. Supportive care, which is sometimes called enhanced supportive care or conservative care, is a proactive and planned way of managing advanced kidney disease without using dialysis. A kidney transplant and dialysis are important treatments for many people, but they are not right for everyone. There are two main aims of supportive kidney care: to keep your kidneys working for as long as possible. This is done with medication and by living a healthy lifestyle. The second aim is to help ease the symptoms that may develop as your kidney function gets worse and to keep a good quality of life for as long as possible. The kidneys work closely with the heart, so controlling blood pressure can help keep your kidneys working for longer and help prevent heart attacks and strokes. Eating healthy food, drinking the right amount of fluid, and staying as active as you can helps keep you well. If you have diabetes, it's important to keep your blood sugar at a good level. If you smoke or use tobacco, try to quit. Smoking harms the blood vessels in your kidneys, making kidney problems worse. It's also important to make sure your medicines are safe for your kidneys and right for you. As your kidney function gets worse, you may get more symptoms. This can either be from kidney disease or another medical problem. The symptoms of advanced kidney disease and kidney failure can sound scary, but not everyone gets all the symptoms, and some people get very few symptoms. Symptoms include anxiety or low mood, feeling tired or worn out, memory or concentration problems, swelling in your ankles, feet and hands, shortness of breath, feeling sick or being sick, itching, restless legs, cramps, and constipation. There are many good treatments to help manage and improve symptoms. It's important to tell your kidney team about your symptoms so that they can help you. The term quality of life is specific to you. Having a good quality of life can mean no pain or unpleasant symptoms, or being able to manage symptoms. A good quality of life can mean feeling happy and not anxious. It can mean being able to do daily tasks, enjoying time with family and friends, being independent, or staying out of hospital. Supportive kidney care focuses on having the quality of life you want for as long as possible. Dialysis is a vital treatment that can help people with kidney failure live longer and improves many of the symptoms of kidney disease. But dialysis doesn't cure kidney disease and has its own challenges. People who need dialysis continue it for the rest of their lives, or until they have a kidney transplant, if a kidney transplant is a good option for them. Before dialysis can begin, a small operation is needed to prepare for treatment. People who have hemodialysis in a hospital or community dialysis unit usually travel there 3 times a week. This means around 312 journeys to and from dialysis each year. One hemodialysis treatment usually takes between 3 and 4.5 hours. It can take a few hours to recover after hemodialysis. Some people find this routine quite demanding. Dialysis at home offers more flexibility than travelling to a dialysis unit. It can help people feel better and live more independently. But having home dialysis is still a big commitment, so it's important to consider how dialysis may affect your quality of life. People having dialysis need to take regular medication and be mindful of what they eat and drink, and can still have symptoms of kidney disease. As with supportive care, we ask people on dialysis to follow a healthy diet and stay as active as they can. Your kidney team can give you more information about dialysis. If you choose supportive care, you will have regular checkups. Your kidney team will check your blood pressure and other health readings and help treat your symptoms. You will receive advice about your diet, fluid intake, and medication, as well as support with planning for the future. You will not need to spend time on the dialysis unit or having dialysis at home. This can free up time to do things you enjoy and see family and friends. Your kidney doctor may refer you to a geriatrician, a doctor who specialises in the care of older people. This is helpful if you have other health conditions or if you're finding things like balance, memory or bladder control difficult. The palliative care team can also help at any time during supportive care. The palliative care team can help manage your symptoms, provide emotional support, help you maintain the best possible quality of life, and help you and your family plan for the future. People who choose dialysis or supportive care usually don't live as long as people the same age who don't have kidney failure. Dialysis generally extends the lives of younger people, but this is not always the case for older people, and people who have had a heart attack or stroke, or who live with dementia or heart failure. People living with frailty who rely on others for day-to-day tasks such as washing, dressing or cooking, or people who spend most of their time seated or in bed, or who live in care homes, often do not live longer with dialysis than without it. It's hard to predict how long you will live if you choose supportive care. It will depend on your age, how quickly your kidney disease is progressing, your general health, and if you have other medical conditions like disease of the heart or blood vessels, cancer or dementia. If you have very little kidney function left, you may die within a few weeks or months. Your health professionals will help you, your family and others in your support network, and share information with you as your health changes. Choosing a kidney treatment can be difficult, but the decision is yours, and your kidney team will help you choose what is right for you. Choosing supportive care isn't giving up. It's choosing a way of living that is right for you. Remember, you have a choice of kidney treatment. Kidney transplants and dialysis help many people, but they are not right for everyone. Some people find dialysis demanding and feel it can get in the way of enjoying life. For some people, supportive care may be the right choice. If you have any questions or would like more information, please speak to your kidney team.